Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal. So today we're going to pick up where we left off on a previous video. We did a video on back pain.
Just make sure you bend your knees when you pick that up.
Pick it up, because you don't want to get back pain.
Right.
We talked about the 4 things that you really want to rule out that could be a problem with your back. That was infection, fracture, tumor, or a fancy thing called cauda equina syndrome. Check out that video. Right. And we gave you like 10 symptoms that were indicative of an emergency or something you need to see your healthcare specialist about.
Right, essentially back pain that you can't just blow off as, hey, I'm middle-aged, you got to sore back.
Yeah, that's it.
So today, what are we doing today then?
We're going to talk about back pain that's caused by things not even in your back.
Non-back pain.
Non-back back pain. That goes under the other category.
Right, so like referred pain, there's lots of things in our body where you'll have a symptom in one location, but the problem actually is in another location because of the way that we're designed.
Right, so it's referred pain.
Referred pain.
Referred pain means you're feeling pain in an area of your body, not where the source of the pathology is.
Right, and what you're going to learn by the end of this video is that just about anything can cause back pain.
Yeah. We don't want to make everyone afraid of back pain, but we just want you to know that there are other things that can cause back pain. These things should not be missed.
Agreed.
All right.
Let's start at the beginning. The most important one.
The one that always scares me is an aortic aneurysm.
Okay, so what is an aneurysm?
An aneurysm is a dilatation or enlarging of a vessel.
Right.
Okay. So your aorta is your biggest vessel, right? Biggest artery, and that can get an aneurysm where it dilates, and then it can actually rupture and leak. We'll do a video on that one day. Yeah. But it can be life-threatening.
For sure.
And it can cause back pain. And your back's fine. No problem in your back. Your aneurysm's causing your pain.
Yeah, and that aneurysm could be in your chest when it first leaves your heart, or it can be in your abdomen. And sometimes it's a slow leak that leads to the back pain, because if it's actually a big leak or if it ruptures, often you actually pass out and then you have to call 911. So it's a big thing. So definitely not something to ignore. So your family doctor would typically find this on a physical examination and then an ultrasound. And lots of people have aneurysms that are small and that they're watched routinely, but we just want to make sure you don't have a big one and a big one that's leaking.
Okay, so there's a non-back problem, back pain.
Number 2 is pathology that comes from the lung. So that would be things like pneumonia, bronchitis, so an infection in your lung, or even lung cancer. This can cause irritation of the lining of your lungs, and that obviously is connected to your back. So your lungs go all the way to the back. This can lead to back pain.
All right, moving down from the lungs, we've got an ulcer, a duodenal ulcer or a perforating ulcer in your stomach. If that leaks a bit of blood, that can cause some back pain, or just if you have the ulcer, you can feel it in your back.
So other things in your abdomen, including ulcers that can cause this, are pancreatitis, so an inflammation of your pancreas that's typically caused by either gallstones or alcohol consumption. That's a big one, as well as visceral cancer. So if you had a cancer of your small bowel, of your large bowel, of the contents of even your stomach, this can lead to back pain because it irritates the lining of your abdomen, called your peritoneum, and this can lead to back pain. Next is urinary tract stuff. So things related to your kidneys and your urinary tract. So what kind of stuff lives there?
Infection, that's kind of the big thing. Urinary tract infection. Prostatitis. Bladder issues, or even a bladder cancer.
And then the last one? The rolling
kidneys.
Stones.
Rolling stones, yeah. So you've got kidney stones. That can cause back pain. All right, then we move into the gynecologic pathology,
which is a very common one.
Gynecologic problems.
Yes.
Even just menstruation, ovulation can cause back pain, even though your back is fine. Or a pelvic inflammatory disease. Or infections.
Endometriosis, and then the one probably that is the most serious that we have to be careful not to miss would be an ectopic pregnancy, where actually an egg gets fertilized, ends up in your fallopian tube and gets stuck there. Then it can cause a rupture that can lead to a significant amount of bleeding, and actually is an emergency and often requires surgery.
Okay, so those are a lot of causes of back pain. There's some diaphragmatic stuff and problems with your diaphragm.
Even your gallbladder, I think cholecystitis can sometimes cause back pain.
Anything else?
I think this is a near complete list. It's not totally complete, but it is near complete list of non-back pain.
Point is, back pain, the vast majority of the time is benign. The vast majority of the time, it's mechanical back pain. It can be chronic back pain, and we have to deal with it. Mechanical back pain, we call it. However, in our other video, we talked about 4 things in your back that we got to watch out for. And in this video, we're talking about things that aren't in your back that can be dangerous, that can cause back pain.
And this is what your doctor's going to think about. If they do all the, hey, you've had pain too long, so we need to find a cause, and then they look for all the back causes and they don't find anything, then they're going to start looking for the giraffes.
That's it.
and the zebras.
That's it.
Okay, if you like this video, please like it, subscribe to our channel.
And we once had a comment that we spoke too fast. Sorry, I think we just did it again. You are in charge of your own health.
We will see you next time.
Bye.